So, what were your symptoms like before coming here?
Okay.
What brought you here?
I'm a diabetic, type 2 diabetic, and I was on taking insulin. I'm insulin dependent, and I was taking so much insulin that it bothered me, and I want to try to get my diabetes under control. Basically, that's what I want.
Okay. And what was your blood sugars like before coming here?
Oh, they ran really around 200, 150. I could not get them under 100 because I know to be controlled, it's 100 and below, and I just couldn't get below 100.
And how much insulin were you on at that time?
Oh, I take average like around 30 to 40 units, and was taking it 3 to 4 times a day.
And tell me about your overall feeling of health. How did you feel back then?
Well, I really felt it bothered me. It was stressful because I know what diabetes can do for you because my mother was a diabetic, and I really want to get diabetes under control because I know it affects all your major organs.
And so tell me about how long have you been coming here and how you feeling now?
Okay, I've been coming here since October of '09, and I went into the program with Dr. Steph, and I'm on the supplements, and she taught me how to eat. See, I never knew what to eat and what was bad for me and what was good for me. So I've learned that, and through that and learning what to eat and what not to eat, it has made the biggest difference. So just learning what to eat and when to eat it, and even what you eat for snacks, like the nuts, all natural, and I was never taught that before. So just learning how to eat and what to eat, and I'm never hungry. I eat basically, I could eat 3 meals a day and snacks and never feel hungry. And really now I do not miss the foods that I used to eat. And my problem was sweets.
So you've been able to stay away from the sweets?
Yes,
That's
I've
good.
been able to stay away from the sweets. Yeah.
So tell me about what your blood sugar is like now and what the amount of medicine you're on.
Okay. Now my blood sugar is under 100, or sometimes it go like to 101, 111, which has never been like that before I started coming here. So I am really proud, and I love the program. Like I said, I don't even get hungry. And matter of fact, Dr. Steph had to tell me that you got to eat a little more, and and I wasn't doing the snacks like the walnuts and the pecans and the almonds because I wasn't feeling hungry. But she had to tell me you still had to eat your snacks, your nuts, and your fruit, your apples and all. So I am just so thankful. I learned about the program by reading in a magazine, and I said, well, I wanted to do something to get the diabetes under control.
Have you tried anything else in the past to get it under control?
Well, no, just going to the doctors, and I have gone to a nutritionist before, but a lot of stuff wasn't explained to me, like Dr. Steph explained it. So I was eating the wrong things. Basically, that was my problem. I was eating the wrong things. I didn't know any better. But now I really have it under control.
great.
And I really enjoyed the program.
Since working with Dr. Steph, how much insulin are you on now compared to what you were on before?
Well, before I was using like 20 and then sometimes 30, and at night even 40 units. But now I'm down to 10 units. Most I think I use is like 20 to 24,
Wow.
which is a major difference. My glucose count was up to, it had went as high as 11. When I went to my diabetes doctor, who I still see, when I was there, I think in January, my count had went from 11 to 7. So I go to see her in April.
What has your diabetes doctor said to you about what you've been doing?
She said, I don't know what you're doing, but whatever it is, keep going. So I explained to her, the program I'm on and what I'm doing, and she said she sees a big difference and just keep it up. So she was really proud because she was really concerned because my count was so high. So she was really, really proud of me and what I was doing and the program. And I told her about the program, and she was really glad because, like I said, and my count changed like 3 to 4 points.
That's really good.
Now,
would you suggest coming here to anyone else? I mean, would you give this a good reference to anyone?
Oh yes, and matter of fact, my family. Number one, I started with my family, and my husband. He has decided that he's going to come also. Yeah, and I have 2 daughters, and they said, "Well, what you doing now, Ma? What you doing?" And the way I cook for myself, I cook for them now. And my husband has even lost weight. Yes. So yes, I would recommend it to anyone. I think it's a wonderful program. And I'm really enjoying the program and getting my diabetes under control, which I never thought it would be, like that.
Well, congratulations, you've done really well.
Yeah, I am doing really great. I am so proud of myself, and I never thought to see this respond in such a short period of time, because since October, and this is just March, and I really, really, really feel good.
Oh, that's awesome.
Yeah.
Thank you so much.
Yeah. Oh, you're welcome. Thank you.